Hello, my name is Sarah Smith, and I thank you for joining me this evening. I will be talking to you about cervical cancer. You might be thinking to yourself, what do I want to hear about cervical cancer for? Cervical cancer is the third most common cancer in women worldwide. As a woman who has had cervical cancer, I think it is very important for me to share this information with you. Most cases of cervical cancer can be prevented. 99% of cervical cancer cases contain the DNA of HPV, the human papillomavirus. There is now an FDA-approved vaccination for HPV called Gardasil. In 2006, I went to my gynecologist for my annual exam, which I had missed the previous 2 years. 1 week later, they called me back to tell me that I had abnormal Pap results. I needed to come back to the office and have another test done. This test is called a coloscopy. A coloscopy is where they do a Pap exam, but they use a microscope to take a closer look at your cervix and remove any abnormal cells. A week later, at my follow-up appointment, they told me I had the early stages of cervical cancer. My treatment was LEAP, which removes the cancerous cells from my cervix by burning them with electricity. I then had to get follow-up Pap smears every 3 months for 1 year, and then every 6 months for the next year. After 2 years, I was able to go back to the once-a-year exam. So far, I have been cancer-free. Cervical cancer starts as a precancerous condition called dysplasia. Dysplasia is abnormal changes in the cells on your cervix. Dysplasia can be detected by a Pap smear and is treatable. These precancerous changes, if go undetected, can develop into cervical cancer and spread to your bladder, your liver, and your intestines. I would like to show you the following pictures. The first picture is of a normal cervix with no abnormal cervical cell changes. The second shows dysplasia around the cervix, which is the early stages of cervical cancer. The third picture is of cervical cancer that has not spread from your cervix. The fourth picture is of cervical cancer that has spread throughout the uterus and your vagina. Almost all cancer is caused by HPV. There are several different strands of HPV. Some of the strands may cause genital warts, others cause cervical cancer, and others are just there and don't cause any damage. HPV is caused by sexual intercourse. The vaccination Gardasil protects you or your child from HPV. The FDA has approved Gardasil for both males and females ages 9 through 26 who have not already been pre-exposed to HPV. It is given in 3 injections over a 6-month period. However, not all cases of cervical cancer are caused by HPV. There are several risk factors for cervical cancer. These risks include having sex at an early age, having multiple sex partners, having sexual partners who have had high-risk sexual encounters, and also if you do not have your regular Pap smears to check for cell changes. By getting regular Pap smears from your gynecologist, you are one step closer to protecting yourself from cervical cancer. If a Pap smear is done in the doctor's office, a swab is taken from your cervix and sent to a lab to check for any cell changes. If the lab does find any abnormal cell changes, your doctor will notify you, and you may have to have another Pap test done, or a more advanced test called coloscopy, which is similar to the Pap smear, only a large microscope is used to look more closely at your cervix. If you have an abnormal Pap smear, it is very important that you follow up with your doctor. There are several different treatments for precancerous changes to your cervix. For early cases of cervical cancer, the treatments include LEAP, which uses electricity to remove the abnormal cells from your cervix, cryotherapy, which freezes the abnormal cells from your cervix, and laser therapy that burns the cells from your cervix. In more advanced cases of cervical cancer, you may need chemotherapy or radiation, a hysterectomy or pelvic excision, which is an extreme surgery where all organs in the pelvis are removed. In conclusion, cervical cancer is the third most common cancer in women, and it's preventable. By getting regular pap smears and having protected sex and getting the Gardasil vaccination, you are protecting yourself. It is very important to protect yourself and your loved ones from a preventable cancer. I know that if I had the option to get vaccinated, I would have gotten it to help protect myself. I received my information from Cancer That Starts in the Cervix at www.women-problems.com, cervical cancer at www.nlm.nih.gov, and Gardasil at gardasil.com.